Today's episode of Leitrim Daily talks about suicide prevention and mental health. In case anyone listening to the show might experience any issues while listening to some of the content today, we have published a list of phone numbers on our website and in the show description to talk to somebody if you're feeling like you need to do so. The Samaritans are available on 116 123, Aware are at 1800 80 48 48, while Pieta House are available on 1800 24/7 24/7. Let's get on with the show. Hi and welcome to Leitrim Daily. My name is Breffney Early and you are listening to A Current Affair here on the podcast. It's episode 113 and today I am joined by two community mental health nurses from County Leitrim to talk about what their role entails, as well as the new Lifting the Silence of Suicide programme. And we'll also be casting an eye forward to the Health is Wealth event next February in the Landmark Hotel here in County Leitrim, which looks like a great night out for anybody interested in the promotion of mental health in the county. Hubert McHugh and Valerie Cogan, welcome to Leitrim Daily.
Thank you.
Thank you, Breffney.
It's great to have you here on the show because a lot of people are very familiar with your name, Hubert. You've been Leitrim Person of the Year in the past.
That's correct, yes.
And this Health is Wealth event has been very high profile across the county over the last few years. Some really phenomenal people have come down and shared their stories. And yourself and Valerie you've been in the county for
45 years.
And Valerie, you've been working in this.
I've been in Leitrim since 2009.
So you've been about a decade as well. So yeah. You're both very familiar with Leitrim and its people and what goes on. Maybe let's start with the new project that's been launched at the moment. It was launched during the week in the Chamber and the Leitrim County Council, Lifting the Silence of Suicide. Which one of you would like to tell me what that's about?
Go ahead.
Well, it's a programme that's been led out, I suppose, by Tomas McBride, who is the Suicide Prevention Officer that covers the Sligo-Leitrim area. It's a programme that will be running over the next 3 months. From the 5th of November is the start date, and it'll run for the following 3 months. It will involve programmes being run and workshops within local communities for people who can go and, I suppose, try and learn skills and to understand, that you don't have to be a professional to help somebody who's struggling with their mental health or mightn't be feeling too well, that it will help them and give them confidence in dealing with people like that as well.
So these are going to be small local events for local people in their communities.
Yeah. What
can people expect on any given day?
Within the programme, I suppose it'll be a general overview of issues within the community. Like loneliness and isolation is a huge problem for people living in rural Ireland and living in rural Leitrim, and it's young and old, it's everybody it affects in some ways. We're all connected through technology and devices, and we're still so disconnected from each other, and you can have 200 friends on Facebook and you mightn't have one person that you could pick up the phone and ring when you need to talk to somebody. And I suppose it's bringing people together to give them confidence in dealing with somebody who they might be worried about, and not being afraid to shy away from, asking somebody, well, are you okay, or is there anything I can do, or, do you need to talk? So that's really what it's about, trying to connect people, and it's all about encouraging people to connect with themselves and understand their way of thinking and how they feel and how their thoughts affect how they feel, and connecting with others then as well, and obviously being a part of a group. And we both advocate very strongly for volunteering. It does so much for your mental health, and it boosts your mental health, and it's that idea of being part of something that's bigger than yourself, and the satisfaction you get from doing something as well for others is great.
Are you really directing this towards people who suffer from mental health or deal with people who suffer from mental health, or is this for anybody in the community to come along
It's anybody in the community, and mental health issues affect everybody. There's nobody immune from it. There's nobody that couldn't gain something from these workshops or these talks, even if it never affected you directly. There's a high likelihood that you've come across somebody or know somebody that has.
Very, very true. Hubert, you've many, many decades of experience in this in the county. In terms of these events, how important are these within communities for people to identify maybe what's going on behind the scenes in their own communities?
I think they're very important. You know, there's been the stigma about mental health issues, and that was much worse when I started out here in 1980. And thankfully, that stigma isn't as great as it was, but there's still a bit of stigma there. So this is Tomás McBride and the team taking these seminars out to rural areas, well, I'm not saying Carrick isn't rural, but Ballinamore, Manor Hamilton, Drumkeeran, Drumshanbo, and, you know, working through sometimes the GA clubs in the local area, and, you know, spreading the news that way, getting people to come in and to listen to experts and, you know, hear them give their views on mental health. And as Valerie has been saying, you know, mental health, you know, is important to everybody and affects everybody. And it doesn't take sometimes a community mental health nurse to come to somebody who has an issue. If you had a good friend and you could talk to them and they identified you as having a problem, and that chat with them could help you just as much as you know, a professional doing it. Sure, then if they feel you need professional help, you need to go to your GP and be referred on. But it's so important that everybody is au fait with the symptoms of suicide, and you know, it's asking people to not to be afraid to ask for help and say there's something wrong, and to then ask them to go for help.
In terms of these events, you've mentioned a couple of locations that this might be visiting, but where can people find out when and how they can get involved in that?
Look at in the Leitrim Observer, we launched it in the council chamber, and it was great to see the turnout of the local councillors and the administration staff at the council and the Leitrim Observer. It'll be in the Leitrim Observer, it'll be in all the parish bulletins for people who go to Mass. It'll be on the local radio stations, Shannonside and Ocean FM. And, you know, it'll be all over the media to encourage people. I know the GA has taken this on in a big way and will be promoting it through their clubs as well.
Excellent. So just basically keep an eye out on the local media and local bulletins, and it will be made available to people where they want it, where they need it. That's fantastic. Valerie, you said something that interests me, and it's about rural isolation and loneliness. Tell me a bit about that and how big of a factor that is in the day-to-day work that you do as a mental health community nurse.
It's a huge factor, and I suppose it's something that Hubert would have talked about extensively over the last few years, and it was something during the time that he was Leitrim Person of the Year in 2017 was one of his main aims, was to highlight, you know, the issues around social isolation and the importance of connecting with people and being a part of a community, and encouraging people to try and, you know, join groups or volunteer for things, or, you know, just to try and encourage people to connect with each other. And but rural isolation, and you don't even have to be rural to be isolated. You know, you can be living in the city and be as isolated as you are living out in the middle of nowhere. And it's really about just try and encourage people to, you know, to see what's out there. There's loads of great voluntary agencies out there that have things going on. There's even the men's sheds locally in a lot of areas now, which are great and give a lot of support to a lot of people. You know, things like the ICA, all of these things, there's loads of different things that you can get involved in, and I suppose to try and encourage people to do that and, you know, to see what's out there locally for you.
Hubert, you've been, I suppose, you've seen an awful lot of things in your time in the county. What would be, because obviously you can't talk about a lot of what you do, because it's of the sensitive nature. Yeah. In terms of what you can talk about, what does a week in the life of a community mental health nurse look like?
Well, it's an extremely busy time, and I must say I thoroughly enjoyed it, and I always got up and went off to work very happy because I always enjoyed helping people. And I must say the people of Leitrim were so welcoming of me, and they've taught me an awful lot more maybe than I have helped them. And, you know, you get up, like say on a Monday, we'd be going down to the hospital where our main base is, and there's 25 beds there, and we're the 2 community mental health nurses for the South Leitrim area, and our consultant there would be doing a ward round, and they'd be planning for discharges, and, you know, we'd be involved in all that when they come home. We do clinics. We have clinics, say, in Carrick and Shannon every week, but the 3rd week we're in Drumshanbo the 2nd and 4th Thursday of every month, and we're in Mohill the 1st and 3rd Thursday of every month. We have our multidisciplinary meeting then on Tuesday afternoon in Carrick, and the GPs then who would get all, you know, would be seeing these clients, they would be referring them to our service. Sometimes they'd be asking us to go out and do an assessment on them and get, you know, work them up and get them seen by the consultant. And, you know, we'd be visiting people in their homes, dealing with them, but building up a bond with the family, building up trust with the family. And I think this is so important. Like, they're like my family, and I'm sure Valerie would say the same, like her family. They trust you. So if there's something happening in their lives, it mightn't even be mental health, they'll share it with you, and you're able to support them and work through whatever crisis they're in with them. And this is what makes the job so fulfilling.
Valerie, how big of a problem is mental health and suicide in this region at the moment? Because anecdotally, it would appear to be as big a problem as it ever has been.
I suppose the suicide rate in Ireland in general is too high. One death is one death too many, that people die by suicide, and there's a lot of good work being done out there to try and address this problem, to address the stigma really around mental health, and to get people talking, and to get people to be not afraid to say that they're not feeling well or that there's a problem. Or, you know, people can get very overwhelmed sometimes by what one person would think isn't really a problem. To them it's a huge problem, and sometimes encouraging people to talk to somebody about whatever is bothering them gives them another perspective, and it doesn't seem so bad. But it's to get people to, I suppose, understand that it's not a weakness to look for help, and it's not a weakness to say that you're not feeling okay. And I think that's the most important message of all, to try and get out to people and to try and encourage them that, you know, there is another way, you know, there is help there.
In terms of the 10 years you've spent in County Leitrim, what are the biggest differences you've noticed in that period in terms of how mental health is maybe spoken about as much as anything else?
I think mental health, it's one of those subjects where it's not a subject maybe that people like to talk about very openly, but I think we've come a long way in the last 10 years to try and address that. And I think Leitrim's Health as well has certainly tried to bring mental health issues to the fore, to try and break down that stigma, to get people to start a conversation around mental health, that it's not a taboo subject like it was years ago. And people have come to us since Leitrim's Health as well and said, you know, they had a family member that had mental health issues years ago, and they hid behind a cloak of shame for years because of that issue, and they were very thankful that this was being brought out in the open and people were discussing it so openly, and it I suppose reduced the shame for them in a sense that they held on to for years, which, you know, there's still a little bit of that there, and we still have to keep working at it to try and break that down, but we're making inroads into that.
Hubert, let's talk about Health is Wealth and the event that's happening in Valentine's Week, the 12th of February next
12th of February, and I want to pay a tribute to Valerie here, because it was Valerie thought up of Leitrim's Health is Wealth. We were meeting in the Bush Hotel at a meeting, and she said to me afterwards, there's something I want to talk to you about, and she mentioned about, you know, we had been talking about volunteering and all this. She said, I think we should do something, you know, like have a seminar to destigmatise mental health and help promote it and all that. And that a cold evening in the Bush Hotel, Leitrim's Health is Wealth was born. So I want to thank Valerie for coming up with the initiative. And yes, we're going ahead with it. This is the 4th year. This is unfortunately our last year because I'll be retiring and Valerie's moving on to work with older people in Ballymote. And we have moved this year to the Landmark Hotel because we had something like 650 people last year in the bush. And, we're going into a bigger venue, so hope we can fill it. And again, we have Paul Williams, another Leitrim Person of the Year, and who did a wonderful job for us last year, coming down to be MC. And we have Michael Harding speaking at it, Father Brian Darcy, Sean Kane, and Dr. Ed O'Mahony. And on the females, not forgetting them, so important, we have Catherine Corliss, we have Valerie Cox, Nicole Owens, and Jimma Willis. And Minister Jim Daly is coming down to launch the event on the night for us, the Minister for Mental Health.
That's a phenomenal list of people, and so many recognisable names in there as well. But the thing that nearly impresses me the most is 650 people in Leitrim gathering to talk about mental health. That must be unthinkable from back in 1980 when you started here. Unthinkable,
and it's only like when I was up in Dublin at the launch of the Leitrim supporters or that people have said, this is a very unique event, and Valerie talked about it as well, the benefits families and people have got from it. And I don't want to be blowing a big head on ourselves now. I think we're the only event in Ireland that does something like this and that gathers such numbers, and it's a testament to the event and to the speakers at it that people, and this is aimed at local people, it's a free event, you don't have to pay into it or anything, and we work in tandem with the Leitrim County Board and the Leitrim Observer, our media partners, that just local ordinary people turn up in them big numbers to it.
It's absolutely amazing. What's the most positive thing, Valerie, that you've seen in the 3 previous years? What's been your takeaway moment of Health as Wealth?
Oh, there's been so many. I don't know. I suppose the first year was 2017. We were very unsure really how it would go. There was a lot of people who thought it wouldn't work. And we kept going. We tried our best. We had a great crowd in the Bush Hotel that first night. And it was meant to be a one-off originally, and because of the response we had and the effect it had on people that were there and who saw it, they encouraged us to keep going with it, and we're heading for our 4th year now, so we're delighted. And we try and cover lots of different topics and issues. We've covered addiction, we've covered depression, all sorts of things. Geraldine McCarthy spoke last year. She is a consultant psychiatrist with the Psychiatry of Old Age Service, healthy ageing. It's a very positive night, even though mental health isn't always a positive subject. It's a very positive night, and people always come away with a good feeling from the event.
You talked about how the suicide rate in this county is too high. What can we do as a community and a society to lower that individually? Like what can one person do?
I suppose it's going to sound very simple, but I suppose just be aware of the people around you, be aware of the people in the community, be aware of the people who are vulnerable. Try and encourage people to be connected with each other, even if it's only in your own local area. That's all you can do, and it might sound very simple, but that can make a big difference to people. And especially when people are feeling lonely or feel very alone, it can be a great help to know that people around you care and want to help you and to help the people around them.
And I suppose, Hubert, if someone is struggling themselves listening to this, obviously there's a lot of services out there that they can reach out to. What would you recommend as a first port of call for someone who's maybe not quite feeling themselves? Of course,
their GP, they're the primary person they should go to, and if they do go, they'll always get a good listening ear. We have wonderful GPs here in South Leitrim who are very tuned in to the whole thing of mental health, and I think that's the first port of call. But even to tell a friend, a neighbour, what Valerie has been saying, there's the Samaritans out there, there's Stop in North Leitrim, there's Grow, there's several wonderful organisations. There's Breffni Mental Health here in Carrick-on-Shannon, but talk to somebody about it. Don't hold it in. Tell people, and I'd ask people out there to look out for vulnerable people in the community. elderly people living on their own, just be looking out for little signs to see if there's something the matter, pick up on it and, get them talking. And I'd ask if anybody was vulnerable, please talk to somebody about it. There's plenty of wonderful help out there and great people working on the ground in all the services that'll be only too delighted to help them.
Absolutely, and I suppose we will put a list of all the various contacts for the likes of Aware and Pieta House, as well as the organisations that Hubert mentioned there on the website and in the description here of the podcast. So please get in touch with one of those professional people who will be able to help you, or just have a cup of tea with someone and have a chat and see how you feel afterwards. I know from personal experience it can be just good to talk sometimes. You mightn't even leave the room, but it's just good to share a problem. Thank you so much for coming in. I'm going to ask you just to recap quickly the two events we're talking about, the Lifting the Silence of Suicide, just in terms of when and where people can expect to find that, and also just the Health is Wealth again. Yeah,
I suppose look out for the Leitrim Observer. I'm sure it'll be, the church bulletins for people who go to church. It'll be promoted, all the areas that are doing it will be promoting it, and there's a big media campaign going on to promote it, so you're going to hear about it.
Excellent. And then of course Health is Wealth, 12th of February next year in the Landmark. Put it in your diaries now and see more, I suppose, closer to the time as well. Hubert, very best luck on your retirement.
Thank you.
Have you got any plans of what you're going to be getting up to? Is the garden going to be looking fantastic?
I'll not know what to do with myself, but I'm sure I'm involved with a number of voluntary organisations that I'll continue to try and help people.
Excellent. And Val, are you moving on to a new role?
Yeah, moving on to a new role. I will miss Leitrim, and I've had a great time since I've been here. Hubert has been a great mentor to me and taught me an awful lot that I will bring with me when I go on to my next job, but I've really enjoyed Leitrim.
And I suppose for those listening who might be a bit nervous about what might happen in the vacancy that's created, when are we likely to have replacements, or is that...
it'll happen immediately we leave. There'll be two good people coming to take our places.
Always good to hear. Not that you'd be easily replaced. Hubert McHugh and Valerie Cogan, thank you so much for coming in to have a chat with us about some fantastic events coming up over the next few months, and a very worthy reason to come in and have you chat with us. Thanks so much.
Thank you, Breffany.
This is, of course, a current affair on Leitrim Daily. I'd like to thank both of my guests today for coming in and have a chat with us. I will be back tomorrow with the Arts Show, where we're visiting the Glen Centre and sitting down with the director there, Brendan Murray, for a chat. Talk to you then. Today's episode of Leitrim Daily talks about suicide prevention and mental health. In case anyone listening to the show might experience any issues while listening to some of the content today, we have published a list of phone numbers on our website and in the show description to talk to somebody if you're feeling like you need to do so. The Samaritans are available on 116 123. Aware are at 1800 80 48 48, while Pieta House are available on 1800 24/7 24/7. Let's get on with the show.